You are listening to the Journal of Rheumatology's Editor's Picks with Dr. Earl Silverman, Editor-in-Chief.
This is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology, welcoming you to the August 2025 edition of Editor's Summary. This month's features interview is by our Associate Editor, Dr. Amanda Steinman, who interviews Dr. Sebastian Satouit and Mr. John Stadler as they will be discussing their article titled Fragility and Associated Outcomes in Patients with Vasculitis.
What motivated your team to examine frailty and vasculitis, and why do you feel this concept is particularly important in autoimmune rheumatic diseases?
Wonderful. I'll take the physician answer or to this question, which is at this point we know although this concept emerges in the geriatric and the geroscience literature and recognizes this syndrome that is associated to kind of a decrease in physiologic reserve that is associated to worse outcomes, initially described in older adults. Our concept and our knowledge of frailty has continued to evolve to better understand that this is by no means just a process associated to chronological aging, but also to a multitude of other factors. And what I usually kind of say that it's the not missing link between the connection of frailty and geriatric syndromes in our population is the role of chronic inflammation. So chronic inflammation has been recognized as an important factor that drives a lot of different kind of syndromes and aspects of aging, including the development of frailty. So that, besides the fact that the use of frailty is now being used in other specific medical fields to better understand outcomes and better kind of identify patients at risk for worse outcomes, inflammation makes also kind of the connection with our field in rheumatic diseases. We know from other conditions, and there's emerging literature with regards to rheumatoid arthritis, systemic lupus erythematosus, and now vasculitis, where we know that frailty has identified patients who are at risk for worse outcomes. And I think we're getting into a lot of our field where we're trying to expand and know that we need to improve outcomes in our patients beyond just the construct or the specific measures of the disease. And I think patients constantly remind us about this. So I think with the advances in treatments, we have the opportunity to expand our lens to better improve the outcomes of people who are living with chronic rheumatic diseases. And I think this novel lens allows us to assess vulnerability in a different way with the goal of actually developing a new target that allows us to better identify this. So our goal was this relevant. I've mentioned kind of all the points that it touches this. There's some data that has been done, particularly in patients with mild vessel vasculitis, but this study allowed us to better understand this throughout a broader spectrum of people who are living with different forms of vasculitis. So that's my physician answer to this, but I'll pass it on to John, who might have his view as well as a patient partner.
Thank you. As a patient who has vasculitis, it was very intriguing to me to understand what frailty was about, because in the early stages of my disease, I certainly experienced it. It was a long period of time which it existed and eventually got better. But it took me by surprise, and it was also something that was very difficult to live with, being 62 years old with the disease and suddenly having all the symptoms and issues. And I was pleased to be able to understand to a greater depth of what it meant to have frailty and how frailty affects the quality of life that we live.
I hope you enjoyed listening to Dr. Steinman's interview with the authors of the paper titled Fragility and Associated Outcome in Patients with Vasculitis. And we'll listen to the full interview, which is available at our website, www.jroom.org, or on our YouTube channel. Now, moving on to the other articles. This month, we have two editorials. First is called Caribbean Crossroads in Rheumatology, Strategies to Establish Our Regional Rheumatic Disease Burden with Lessons and Opportunities to the Global Community, and is by Drs. Davis, King, and Flower. with this editorial is a second editorial. This is by Dr. Wolf and is called Reversing the Tide of the Growing Burden of Avoidable Musculoskeletal Pain and Disability. Now to the summarized articles. First paper this month is by Dr. Guthuambi and co-authors, which is an update of their systematic review of quality measures for rheumatoid arthritis, which was published in the journal in 2018. The next paper stays with RA, and in their paper titled Cone Beam Computed Tomography for Assessment of Erosions in Early Rheumatoid Arthritis, a pilot study, Geertsen and co-authors compared cone beam computed tomography with conventional radiography in 17 patients with early RA. In this 12-month study, they showed that cone beam computed tomography was more sensitive than conventional radiography to detect both erosions and repair in patients with early RA. Previous studies have suggested that mucosal-associated invariant T cells, or MATE cells, may be involved in the pathophysiology of ankylosing spondyloarthritis. In their paper titled Analysis of Gut Homing Receptors in Circulating Mucosal-Associated Invariant T cells and their present in synovial tissues from patients with axial spondyloarthritis, Turiso and co-authors showed that patients with axial SPA had activated CD3 positive and CD8 positive MATE cells that expressed homing receptors. Treatment with an anti-TNF agent modulated the frequency of these cells. And in the one patient in whom they had a synovial biopsy, MATE cells were detected in the biopsy specimen. Lifestyle and medicine and complementary and integrative health are adjuvant therapies which have the potential to improve patients' symptoms. Patterson and co-authors in their paper titled Experiences with Complementary and Integrative Health Among Patients with Rheumatoid Arthritis and Systemic Lupus Erythematosus, a qualitative studies used semi-structured interviews of 39 patients with either RA or SLE to examine what patients' experiences were with these alternative health care. They found that diet was the most frequently discussed lifestyle modality and that participants noted that specific diets may exacerbate or alleviate their symptoms. Traditional Chinese medicine and natural products were the most discussed complementary approaches. The primary barriers to using these modalities were the uncertainty regarding safe and effective practices and high out-of-pocket expenses. In order to improve the outcome of patients with psoriatic arthritis, it is important to predict which patients with psoriasis only will go on to develop psoriatic arthritis. Carvo Silva and co-authors in their paper titled Understanding the Psoriasis Phenotype Associated with Psoriatic Arthritis Using the Pure-4 Questionnaire, Insights from Spanish Real-World Settings, found that 18% of the 253 patients they screened went on to develop psoriatic arthritis. The areas of psoriasis in these patients were most frequently found in the neck, knees, hands, and feet, as well as the so-called special locations of psoriasis, which are the scalp, nails, and the palmar plantar areas. These were seen more frequently in those patients who went on to develop psoriatic arthritis than in those who remained with psoriasis only. Previous studies have suggested that male patients with SLE have a higher risk to develop damage than female patients. In their study titled Comparative Analysis of Damage Accrual in Lupus Nephritis Stratified by Sex, Haruf and co-authors studied 460 SLE patients over a median follow-up of 8.6 years. They found that 45% of the patients developed extra renal damage over this time frame, and 32% experienced renal damage. However, there was no significant difference in the accrual of damage between male and female patients, nor in the time to accrue this damage. Patients with JAA had increased school absence for a variety of factors. In their study titled School Absence Among Children with Juvenile Idiopathic Arthritis, a national matched comparison study, Jensen Peterson and co-authors found that patients with JAA had higher rates of absence related to an illness and total school absenteeism beginning 3 years before the diagnosis of JAA, and that this higher rate of absenteeism persisted for the 5 years of the study following the diagnosis. Children of lower socioeconomic status, both with and without JAA, had the highest rates of absenteeism. However, neither social economic status nor the sex of the patient modified the association between school absenteeism and JAA. Blau syndrome is a genetic syndrome characterized by granulomatous inflammation involving the skin, joints, and eyes, and is associated with the NOD2 gene variants. In a multi-center study from China titled Effective Treatment of Janus kinase 1,3 inhibitor in Blau syndrome from a multi-center retrospective study in central China, Hugh and co-authors examined the phenotype, genotype, and treatment response in 24 patients with Blau syndrome. As expected, all patients had anterior uveitis, which was associated with posterior uveitis. Arthritis was seen in all patients, of which the vast majority had polyarthritis. They did not find any association between different NOD2 sequences and response to therapy. However, in 33% of the patients who had the R3334WGG polymorphism in their STAT3 gene, they found an association with a good response to treatment, irrespective of whether this was by a TNF inhibitor or a JAK kinase inhibitor. Conventional radiography and ultrasound are both frequently used for the identification of calcium pyrophosphate deposition, or CPPD. Philippou and colleagues, in their study titled Traditional versus Innovation, Conventional Radiography and Ultrasound in Calcium Pyrophosphate Deposition Identifications, Instructions for Use, determined how conventional radiography compared to ultrasound examination to determine CCPD deposition. The CCPD deposition was verified in surgical knee specimens. All patients had their studies done prior to the surgical examination. Ultrasound demonstrated a slightly higher overall accuracy than conventional radiography. However, when ultrasound was negative, conventional radiography did not improve CPPD detection, but if conventional radiography was negative, an ultrasound did increase the likelihood of a CPP deposition, while a negative ultrasound increased the likelihood of the absence of CPP. The authors concluded that ultrasound may be the investigation of choice for calcium pyrophosphate deposition. New innovations are always coming to rheumatology. Metagenomic microbial plasma-free DNA next-generation sequencing by the Caris test TM or KT, as is referred to, is now available for clinical use. In their paper titled Use of Metagenomic Microbial Plasma Cell-Free DNA Next-Generation Sequencing Assay in Outpatient Rheumatology Practice, Jenkins and co-authors retrospectively reviewed their experience with this technique in their outpatient service. The reason for KT was evaluation of atypical presentation of rheumatic diseases in 80% of the time, was to assess a flare versus infection in patients on immunosuppression in 16.7%, and for fever of unknown origin in 3.3%. Of all the tests, 16% were positive, but only 4% of the tests were considered clinically relevant and altered the final diagnosis and treatment. Of the 126 negative tests, 4% were found to have a clinically relevant infection by conventional testing methodologies. This month, our article for Rheumatology Around the World is titled Access, Effectiveness, Safety, and Survival of Secukinumab in Patients with Axial Spondyloarthritis and Axial Psoriatic Arthritis, a real-world study in Argentina, and is by Martire and co-authors. This paper describes the use of secukinumab in 117 patients from Argentina with axial spondyloarthritis or axial psoriatic arthritis. The article this month from Panorama 360 Degrees of Rheumatology is a poem titled A Dromedary Tale, a tragic commentary on science where relevance over defiance must prevail. This was written by one of the authors following an encounter with a young man who presented with hip arthritis and was subsequently diagnosed with ileocolitis from Crohn's disease. We have two images in rheumatology this month. The first is titled TREX1 Associated Familial Chilblain Lupus with cerebral aneurysms treated with JAK kinase inhibition. And the images show a patient with chilblain lesions, inflammatory arthritis, and a cerebral aneurysm. The second image is titled Novel Photon Counting Computed Tomography for the Evaluation of Large Vessel Giant Cell Arteritis, and illustrates how this technique can be used in evaluating large and small vessel vasculitides. We have 2 research papers. The first is titled Survival After Lung Transplantation in Patients with Rheumatoid Arthritis Lung Disease. And the second is titled Association of Type of Joint Involvement with Distinct Clinical Features and Outcomes in Patients with Acute Parvovirus B19 Related Arthritis. There's one case report which describes a female adolescent with gout and is titled Clinical and Genetic Analysis of a Female Patient with Adolescent Onset Gout. I want to thank you for listening to this podcast and encourage you to read the complete articles in the August 2025 edition of the Journal of Rheumatology. These articles are available either in a print edition or the online edition of the journal, which is available at www.jrheum.org. And I invite you to watch the complete interview this month by Dr. Steinman of the highlighted articles, and encourage you to view any interviews from previous months. They are available for viewing at our website and on our YouTube channel. If you have any comments or questions of any of the articles in the Journal of Rheumatology, please send them to manuscripts@jrheum.com. And please join me next month, for the September 2025 edition of Editor's Summary. Thank you for listening and have an enjoyable rest of the summer.